Hey, so Dr. Amaka here, plastic surgeon. I'm in Nashville, Tennessee. It's surgery day, but let's jump into this. So, blood clots. Of all the surgeries you do, tummy tucks have the higher incidence of blood clots. Several reasons, right? It's a surgery that makes you a little bit more immobilized, so you're not moving as much. Also, it's a surgery where it's a little bit longer. And what happens anytime you induce some general anesthesia, the blood vessels that are maybe let's say they have this tone, relax, right? So that increases your incidence of blood clots. What is a blood clot? Think about it like if you take gel, like let's say hair gel, and you form it into a little ball. That's kind of the idea of a blood clot, and that is flowing through your bloodstream. That's dangerous because if a blood clot goes to your lungs, it can impair your breathing, and then other very devastating complications can happen. So things to do to prevent blood clots. Number one, we use something called sequential compression devices. And those are actually little devices that actually squeeze your legs sequentially. What that does, it keeps blood flowing, right? So blood clots form because there's a stillness to the blood, right? It's not moving as much because you're not mobilizing, you're laying still. And so when it just sits there, it's more likely to form that ball and that gel. But if we have something that can squeeze your legs, that can help prevent blood clots. Another thing we do is early mobilization. So I always have patients every about 2 hours after surgery, get up, walk around the house, just mobilize. That helps too. I always say, like, if you're sleeping, if you're like sleeping at night, I wouldn't like set an alarm and wake up to mobilize because you also have to rest, right? So just mobilizing during the day, during waking hours per se. Something else we do is everybody's a little bit different in their protocols, but something I do because I really want to prevent blood clots at all costs because that is one of the more difficult complications to manage or have. Is I use a medication called Eliquis. It's a blood thinner, actually, and some of y'all might recognize the name. Patients are on that for about a week after surgery. What Eliquis does, it actually causes the blood to be thin. So think about that gel that forms a thick blood clot. If the blood is thin, you're less likely to have that blood want to clump up and form into a blood clot. So if you just make the blood thin for that first week after surgery, so you might ask, well, isn't someone more likely to bleed? Haven't actually had that happen, and the truth is I would rather deal with a bleeding complication than a blood clot, right? Blood clots are life-threatening. And so with that protocol, like the incidence of blood clots are really very low. I ask some patients who have a history of blood clots. That's a big question that comes up. And it's really just analyzing history, talking to their hematologist as well as their primary care doctor to see, are they a good candidate for this? If they clear me, then I have you on blood thinners for 2 weeks, right? So everybody's on it for about 5 days, but people with history of blood clots, I might put on for 2 weeks, provided you get clear. All right, I hope this helps clear this up, y'all.